Hello, this is Sheila Silverman. I'm with the Mental Health Association of New Mexico. We're in Las Vegas, New Mexico. And I'd like to give you a background of what it is that we've been doing here. We've been here working not only as a wellness center, but originally as a drop-in center. And we started back in 2002. And the mission of the Mental Health Association of New Mexico has always been this: it's to provide mutual support, self help, advocacy, education, information, and referral services to individuals who have experienced significant problems in their lives due to a mental illness, and to acknowledge this and to advocate for positive changes within the traditional mental health system. And in that way, what we've done is not only work with people, but we've done a lot of advocacy within the state, and we've done legislation to try to improve things here in this community. To this end, the Mental Health Association of New Mexico provides a drop-in center where mental health consumers can gather in a welcoming, accepting, supportive, non-judgmental, and safe environment. A crisis housing program. This is fairly new, where mental health consumers discharged from the New Mexico Behavioral Health Institute, homeless programs, jail, psychiatric hospitals, and or persons referred by other agencies can live and gain the skills essential to move into community living. This has been a very new kind of program here in New Mexico. And what we're doing is seeing folks. We do have, by the way, two houses, and each house has three residents. And so the goal is to help people to move from the state hospital or into from different kinds of areas where they were just basically going through a revolving door back into the hospital, back into jail, or wherever it was that they found themselves, and to help these folks get entitlements and to move into public housing or into housing that's kind of safe and affordable. So the respite house program is where mental health consumers who require a short stay, where many of the issues that triggered an episode that disrupted his or her life and might have ended in homelessness or in an institution or in a cry for help that was not met. We also provide assistance to mental health consumers to identify individual needs and services to meet these needs through mutual effort, support, programs, and we try and do a lot of referrals. This year, due to the pandemic, our agency has been supporting folks with what we call quick foods. Folks cannot enter our building without a mask, and we do not encourage anyone to stay for more than a few minutes, keeping at least 6 feet away. So, folks served by our organization, they're typically people who have been diagnosed and treated within a mental health facility. That's where we still are seeing most of the people who come, particularly in our crisis housing. Oftentimes, though, they're homeless or staying at a shelter, and these are the folks that we see during the day. But a majority of folks who stop by are the ones who are living in boarding homes. And so the other folks that we see are people from the community. And the thing that's common in this community is the one thing is there's a lot of poverty. A lot of the folks that we see are on disability insurance and Social Security, and they live from month to month without any plans for a future. Additionally, many of these folks are on serious psychiatric medication, lots of physical problems, and that puts them at risk for diabetes, heart disease, weight gain, poor vision, and dentition. They can't afford, a lot of them can't afford to get their teeth fixed. And since so many of them are smokers, their life expectancy is greatly diminished. Data shows that people with mental illness die 25 years sooner than the average person not on psychotropics. Plus, the quality of a person's life is poor. Visiting with consumers in the town of Las Vegas is quite an education. Many are in ill fitting clothing, shoes, clothes not in tune with the weather. Few of them have winter coats, hats, gloves, and if they do not fit properly and are generally stained without zippers, buttons. Certainly, a lot of them are going without shoelaces. The educational level of most folks is also much less than high school graduation. And there are some folks even with college degrees, but few of them are pursuing any path towards higher education, a job, a house, or even for a relationship. Men are rarely paired off with any females. There are some females who seek male company and often encounter brief but disastrous relationships with a male. This summer was a very telling thing. What we had was a lot of homeless people. People made a tent camp at the river. It became problematic, drugs, unsafe for the people in town to walk nearby, and of course, no one was being tested for the virus. The locust shelter remained closed, and folks could only access a food bag from them daily. And this is our one shelter that's here in Vegas. So lots of times, a lot of these homeless people, what we've been doing is clothing them. They come by, they don't have enough clothing, and some of whatever they had, a lot of the times was stolen. And so these folks, what we've done is order things from Amazon, got them clothing. We also got them tents in the summer. But on the other hand, I would like to say we have many successes. We've worked with consumers right out of the hospital who are now completing degrees. But our greatest success lies in keeping people out of the hospital. Our challenge in this time of a broken mental health system are enormous. Folks do not get the therapy they need. Medications are often the original psych meds used in the 1960s, and they have dreadful side effects. Psychiatrists come and go. No therapeutic relationships can be formed with a therapist who leaves after 3 months. Housing is scarce. Affordable, safe housing is almost non existent. I would like to end to say that we welcome people who would like to come and visit. We're open 7 days a week, and we do have the housing that people should come and see. And again, we welcome folks. If anyone has any questions, I've left our contact information, and we again, please call and let us know what's happening throughout the state. We don't have meetings like we used to have, but we're interested in pursuing future mental health that is more successful. Thank you.